Hello, my name is Nehal Desai, and I will be introducing a new slide set on the top 200 meds 2025 list. This is just a list you can use while you're in practice or when you're studying for the NAPLEX exam, or any clinician can actually utilize this. Um, so even nurses studying for the exam, it may help them as well. So, um, as part of this review, I have included a couple of questions here. In fact, the instructions on how to use this med list in these presentations is I'm going to have a set um, in each presentation that will contain a list of medications, and then the next slide will contain a list of questions that you should know, um, whether studying for the exam, NAPLEX, or while in practice. Specifically, a lot of these questions are targeted for the NAPLEX exam, but again, what you see on NAPLEX is probably going to be relevant in the actual practice setting. So it works both ways. So for each drug listed in the set, think about some of these questions below, and any specific key points about them. So like knowing the brand and generic of each medication, or like knowing what is that medication used to treat. Um, and while you're thinking about that, there's certain brand names of drugs that's used to treat one indication and versus another. So you have to know those differences as well. So it's important to know that. And I'll be going over a lot of these type of things in my future presentation videos that you'll see in the future later on. So it's important to know that. Um, Also, the mechanism or drug class. What is the actual, how does it work? What is the actual way of this medication in treating that disease? Um, what is the drug interaction? Which um, medication does it interact with, basically? If you were given a case, a list of medications, and a patient is on those medications, are there any medications interacting with one another that might be altering certain lab values, like potassium, for example? So you have to look at that as well. So, and what are some common side effects of the medication? So, like, for example, a patient taking any sort of like pain medication, and or any sort of cholesterol medication. What are some side effects with that that patient could be experiencing while they're on those medications? And also some counseling points, especially like patients don't know how to use that medication. So how would you teach them how to use that medication? How would you teach them how to use an inhaler? How would you teach them how to use um, birth controller or a injectable? So I just listed a couple of key questions to ask yourself about these things for each drug as you review each set. So each slide after the set will contain questions on the top drugs listed in that set. You may also see questions from the previous set or the previous presentations as well, and the future sets as well. This is just to reinforce certain concepts that you have seen. So I might add a few other things with it, just so that that knowledge is not lost. Um, so it should help you with that. And also, please let me know if you have any other questions. Feel free to comment in any of the videos. And um, if there's anything that I need to add, or if there's anything missing, or you have any questions, you want to go over additional concepts, please let me know. And also, thank you for watching this presentation. I hope this helps you all, especially for those sitting for the NAPLEX exam. I know that can be pretty stressful and all, so um, I'm pushing these questions for you guys so you guys can kind of reinforce certain concepts along the way while you're studying for the exam. And if you have any other questions, please feel free to let me know, and I will get back to you as soon as I can. Thank you for watching, and good luck.